Have you ever noticed a painless lump near your ear or on your scalp that just won't go away? Or maybe your lymph nodes have been swollen for months without any infection. That could be more than just a harmless bump. While rare, one condition that hides behind such signs is Kimura disease. It's not cancer, but it acts like an overactive immune response that creates lumps, often in the head or neck. Mostly seen in young to middle-aged Asian men, it's easy to misdiagnose because it looks like other common disorders. So if you or someone you know has had long-lasting swellings without pain, it might be worth digging deeper. Sounds familiar? So what causes Kimura disease? Well, doctors still aren't 100% sure, but here's what they think. Your body's immune system, usually the hero fighting infections, gets confused and attacks harmless things, like allergens. Imagine your immune system reacting to dust or pollen like it's a dangerous virus, going into overdrive. This overreaction causes swelling and lumps, especially in lymph nodes and soft tissues around the ears, neck, or scalp. Many people with Kimura disease also have high levels of a blood cell called eosinophils and high IgE antibodies, both linked to allergies. So, think of it like your body's allergy response gone wild, even without a clear trigger. It's not contagious, and you can't catch it from someone else. But why it starts, still a medical mystery. Most people first notice a soft, painless lump, often behind the ear or on the scalp. It grows slowly and doesn't hurt, so many ignore it. But over time, you might see more lumps or swelling in your salivary glands, like the ones under your jaw. Some even notice fluid buildup in their legs or unusual urine. This happens when kidneys get affected. Blood tests often show high eosinophils and IgE, like in severe allergies. Imagine you've had a bump behind your ear for over 6 months, your eyes are slightly puffy, and a routine blood test shows high allergy markers. That combo might not be just allergies. Could it be Kimura disease? These signs quietly build up, so awareness is key. First, they will check your symptoms and order blood tests to see if eosinophils or IgE are high. But the real proof comes from a biopsy where a small piece of the lump is taken and looked at under a microscope. The tissue shows unique changes, lots of immune cells, including eosinophils, and unusual blood vessels. Scans like ultrasound or MRI help see the size and spread. Now treatment, there is no single cure, but options exist. Small lumps might be removed with surgery. But if they come back, doctors use steroids like prednisone to calm the immune system, similar to how asthma is treated. Some patients need radiation or medicines like tacrolimus. Even after treatment, regular checkups are important because it can return. So, would you get a persistent lump checked if it did not hurt? Since we don't know the exact cause, there's no direct way to prevent Kimura disease, like taking a pill to stop it. But a strong clue is its link to allergic reactions. So, managing your allergies carefully, avoiding triggers like dust, pollen, or certain foods, and living a healthy lifestyle may help keep your immune system balanced. Also, if you notice any unusual, long-lasting lumps, especially in the head or neck area, don't wait. Early checkups can lead to earlier diagnosis, which means better control. Think of it like car maintenance. Fixing a small issue early saves bigger trouble later. Could you track new lumps like you track your fitness goals? Although Kimura disease is rare, scientists are learning more. Recent studies focus on the immune system's role, especially how eosinophils and IgE cause tissue damage. Some researchers are testing targeted therapies, like drugs that block IgE, similar to those used in severe asthma. Others are studying genetic links, asking, do certain genes make people more prone? In Japan and China, where cases are more common, doctors are building registries to track patients and improve treatments. There's even talk about using biological drugs, like those for autoimmune diseases, to reduce relapses. So while it's still rare and tricky, science is inching forward. Imagine a future where a simple shot could reset your immune overreaction, Could that be possible soon?